Right in through here. Do you feel it there, Mary? Okay. Because you were having some tendonitis in through your infraspinatus.
That's probably where I get that. Is that where I would maybe get those occasional stingers down the arm where it gets like a...
Maybe.
Yeah.
So
That
I'm
doesn't
just gonna...
feel like how this did.
No. It's not, because it's just
tendonitis.
Yeah, it's just the tendonitis. I just want to make sure that... Here we go. Right in through here. So I'm right on the infraspinatus. And I'm walking up. So I'm just going to put the last CC into this area. And you're going to get some of the posterior capsule here as well.